two.
But when you
Sorry,
go
it's so
three,
weird.
you really need
Sorry to breathe for a little while.
and then you're holding your knee. By that time, it's chaos. Are we all ready to start?
A participant has joined the meeting.
We're ready.
Yes, Dr. Shulman.
Yeah.
Before this meeting is called to order, please stand for the invocation and pledge. I ask John Gerhart to give the invocation. He is appearing via WebEx.
Thank you, Chairman. Would you bow your heads with me as we have our opening prayer? Gracious God in heaven, we pause as we begin this meeting of our hospital board, seeking your wisdom and guidance from above. The battle against the coronavirus has been difficult for our nation, for our people, and for our hospital. But we are grateful to be returning to a semblance of normalcy. Grant us measured boldness as we seek to meet the unending and vital healthcare needs of our community, while doing so wisely so as not to suffer from a resurgence of this virus. Bless our national, local, and hospital leaders with not only insight and direction, but also with sensitivity and compassion towards those they serve. Most of all, we ask you bring a sense of your peace and presence into our hearts and lives, that we might all confidently meet the challenges and the needs which surround us during these trying times. These things, together we pray. Amen.
Please join us in the Pledge of Allegiance, please. I pledge allegiance to the flag
Of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Start with the public comment, public board meeting. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to the item on today's agenda, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims. Before we begin the actual meeting, I want
Has joined the
note
meeting.
that some of our members are appearing by
Afternoon,
teleconference.
Hey, Daryl.
Conference day, and you can see that. Sorry?
It was
Has the
perfect.
meeting started?
We are seated to accommodate state.
I don't know. Tram, were you there near Lake
No.
Norman?
Say again?
Are you up here in Carolina?
No. I'm.
Hi, gentlemen, you're not muted, so I think perhaps no. Okay.
Thank you. I'll start over. I want to note that some of our members are appearing via teleconference today, and you can see that they are seated to accommodate state and federal recommendations regarding social distancing related to the current public health emergency. We're also continuing to streamline our meeting process to avoid non-essential items from our consideration. And with that, I seek approval of the orders of the day. Ask for a motion. You have a motion?
Second.
All in favor respond by saying yes.
Yes.
Opposed? Carried. Okay.
Has joined the meeting.
Approval of the minutes of the meeting of April 20th. I ask for a motion approving these minutes.
Second.
Second approved. All in favor respond by saying yes.
Yes.
Carried. Approval of the board committee appointments, finance and investment. As a result of the leadership changeover from a couple of months ago, we have a few changes in committee leadership. As board chair, I'm going to ask Joe DiVirgilio to serve as chair of the Finance Committee and Trim Hudson to serve as chair of the Investment Committee. Do I have a motion?
Move.
Yes. I move approval of Mr. DiVirgilio to serve as chair of the Finance Committee and Mr. Hudson to serve as chair of the Investment Committee as appointed by Mr. Meister, the board chair.
Do we have a motion?
Motion.
Motion carried.
Will you second?
Seconded. And all in favor, by saying yes?
Yes.
Opposed? There are none. Congratulations, Joe and Trent. Thank you, Joe, for willing to take it. All right, the next is the report of the medical staff. Dr. Schulman, Chief of Staff, please.
Is Dr. Schulman on the line, do we know?
Melissa, are you there?
They are all muted right now.
Can you unmute her?
I don't know which one she is. She can unmute herself though.
Oh, Dr. Schulman, if you can hear us, you can unmute yourself. In the interest of trying to move this forward, I know Mrs. Wetzler-Peters actually has the motion that is reflected and comes from the medical executive.
I do have a motion. I move approval of the internal medicine resident privilege form, the emergency medicine resident privilege form, the palliative hospice medicine fellowship privilege form, and the revised ERCP and EUC criteria, all as recommended by the Medical Executive Committee.
All those in favor respond by saying yes.
Yes.
Opposed, no. Motion carries. Next is the Secretary's report. Rick Reiner, Secretary.
Yes, subject to developing conditions, this is our currently intended schedule. On Monday, June 15, 2020, we will meet from 9 to 10:30 for Mission and Planning Committee, from 10:30 until noon, the Human Resources Committee, from noon to 12:30, it is a closed session of the hospital board, from 12:30 to 2, the Finance Review and Board Issues Lunch, and from 2 to 4 is the board meeting. Then on Thursday, July 9th, 2020, we will be meeting from 8 until 11. The board will have its closed strategic planning session. A court reporter will be there and the transcript will be protected according to the law. Thank you. That concludes my report.
Thank you, Brett. Joe DiVirgilio, Treasurer, the approval of the bad debt and charity care.
Yes, thank you, Jim. I move approval of the bad debt and charity care for the month ending April 30th, 2020 in the amount of $20,416,000.
Can I have a second, please?
Second.
All those in favor, by saying yes?
Yes.
Opposed? You have it. Thanks, Joe. Bill Volgen, our Chief Financial Officer.
Thank you. I have in your packets the financial highlights for April and the
Trim Hudson.
it'll be the 7th month
Has
of
left
our
the meeting.
fiscal year. The fiscal year-to-date numbers represent 7 months of activity. Starting with total revenue, and this is in the rating agency format. Our total revenue for April, $67,668,000 compared to a budget of $92,213,000. Through 7 months of activity in the fiscal year, our total revenue is $596,885,000 compared to a budget of $619,249,000. Total expenses in the rating agency format for April, $67,686,000 compared to a budget of $83,781,000. Fiscal year to date, total expenses of $558,208,000 compared to a budget of $574,125,000. Operating income in the rating agency format for April was a loss of $18,000, and it was basically generated an operating margin of 0.0% compared to a budget of $88,432,000, which was a budgeted operating margin of 9.1%.
Has joined the meeting.
Fiscal year to date through 7 months, we have operating income of $38,677,000 which is an operating margin of 6.5%, compared to a budget of
Has joined the meeting.
$45,124,000. We budgeted
Hello.
3%.
Excuse me.
Just, yeah, unmute.
Okay.
Yes, try.
Just muted.
Unmute.
Yes.
Tran, your question?
Yeah, my question is unmute. Are we were muted, and I don't think the board members should be muted.
You can unmute yourself.
You're unmuted, Tram.
Thank you. I had to call back in. Thank you.
No. Tram, the way that it's working is all of the participants are muted, but the board members have the power to unmute themselves.
So how do they do that?
Just leave him unmuted.
Maybe we'll just leave you unmuted.
I think you leave me unmuted. Thank you.
Moving to statistics for the hospital. Average daily, and these are 7-month fiscal year-to-date numbers. Average daily occupancy of 591 patients compared to a budget of 581. Our average acute length of stay, 4.38 days, compared to the prior year, 4.29 days. Admissions, we had 25,142 so far this fiscal year, compared to a budget of 25,745. Surgery cases through 7 months, 13,589 compared to a budget of 15,268. And we've had 2,250 births compared to a budget of 2,192. Outpatient registrations through 7 months, 258,222 compared to a budget of 292,044. And registrations in our 2 emergency care centers, 69,372 compared to a budget of 75,057. And so far through 7 months, our case mix index for all patients, 1.82. For Medicare patients, 1.95. That concludes my report.
Thank you, Bill. Committee reports, governance committee, Joe, please.
All right, thank you. The Governance Effectiveness Committee met this morning. As our first item of business, we interviewed candidates to fill the central seat vacancy left by Bill's resignation. We were very lucky to have 2 extremely well-qualified candidates. After interviewing both candidates and discussion by the Governance Effectiveness Committee members, I am most pleased to now move to appoint Sarah Lodge to fill the central district seat number 1 pursuant to section 1, subparagraph 4 of the Sarasota County Public Hospital District Charter.
Second.
Second.
All those in favor respond by saying yes.
Yes.
Opposed, none. And Sarah, on behalf of the board, we want to welcome you on our team forward to going forward and keeping SMAs at the top of the class.
Thank you so much. I'm honored and I look forward to helping him.
Continue to.
Right, next we reviewed our board self-assessment and the annual evaluation we do of ourselves to compare other governing boards. Next on the agenda, we reviewed the settlement authority resolution of the board. It has not been updated in some time, and we're now updating it to take into account the current limits on the waiver of sovereign immunity. And if I could ask,
I'm over here now.
there you are, you moved on me. If I could ask Caroline Kalish if she could read the resolution.
In consideration of the fact that it's hard to read with my mask on, I'm just going to highlight that the resolution grants some settlement authority to the president of the system, that it reaffirms the authority of the Claims Adjustment Review Panel, and then grants some authority to the risk manager. This is all published on the board's website, and the resolution, if passed, will then become effective today.
Do we have a motion?
I have it right here. I move to approve the claims settlement authority as outlined in the foregoing resolution and as recommended by the Governance Effectiveness Committee.
Second, please. Second. All in favor, respond by saying yes.
Yes.
Opposed, none?
Yes.
Motion carries.
Finally, we reviewed and conducted our routine review of several board policies, and I have a motion in regards to that. I move approval of the board policies on transparency and public reporting, safety net services, and other community benefits programs, and setting performance goals for the president as recommended by the Governance Effectiveness Committee.
Please have a second.
Second.
All in favor, respond by saying yes.
Yes.
Yes, have it carries. Thank you, Joe. Can you continue, please, with the Finance Committee report?
Okay. The Finance Committee also met this morning. Charles Baumann, Chairman of the Board of the Community Health Corporation, gave a presentation to the committee which described the history and purpose of CHC and provided an overview of its current activities and financial.
More boo-boo. What's going on now?
We're on the Finance Committee.
Okay, there we go. More boo-boo. What's going on now?
They're talking about the CHC presentation. It's very difficult for people on the phone to hear distinctly what you're saying, Joe.
All right, I'll speak more loudly and slower.
I think it's more closer to the microphone than it is your enunciation.
Can we move that, Michael?
Stand by.
Yes, actually, that would work perfectly because David is the next presenter, so there we go. Thank you so
Hang
much.
on, Tram.
Well, I think it's more than me. It's Daryl too, and anybody else that's listening.
Hey,
That's
I missed the date and time of Michigan planning. When's the next one?
Best I can do for you.
Can you, Daryl, can you hear me now?
Yes, can you hear me?
I can. All right.
When was
Let me start at the top.
When's the Michigan planning meeting scheduled for?
June 15th.
June 15th? In the meeting room?
Daryl, I'll make sure Karen gets you specifics as to the next meetings that are when they're going to take place.
Very well, thank you.
You're welcome. All right. The meeting of the Finance Committee was this morning. Charles Baumann, Chairman of the Board of the Community Health Corporation, gave a presentation to the committee, which described the history and purpose of CHC and provided an overview of its current activities and financial condition. The CHC is very important to this district as it works to maintain and enhance the financial well-being of the system by providing indirectly and indirectly for the delivery, financing, and support of health care and health care related services. And I don't have any motion in regards to that report. Secondly, Bill Wilgen, CFO, updated the committee on matters the Corporate Finance Department has been working on in response to COVID-19 pandemic. Corporate Finance has been working to gather information and account for the federal CARES program grants, the business interruption insurance claims, FEMA claims, Medicare advance payment funds. They prepared or is preparing the income statement for forecast for fiscal year 2020 and reviewed the foundation grants request for COVID-19 related needs. Bill Wilgen, CFO, presented a request to increase the fiscal year 2020 capital budget by $1,226,068 for equipment that has been purchased to fight COVID-19. And if the capital budget were not increased for these purchases, we would not be able to purchase other items in the approved budget. Accordingly, I move approval of an increase to for the fiscal year 2020 capital budget in the amount of $1,226,068 to accommodate this equipment.
Second.
All in favor, respond by saying yes.
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 Opposed, no. You have a motion carried.
No.
Thank you, Joe.
Okay, next up, Bill Wojin, CFO, updated the Committee on Insurance Policies, which were renewed on April 15th. The insurance rates have increased due to global events which have occurred over the past year. Property insurance has been renewed with similar coverage to prior years with a premium increase commensurate with the increase in property value plus a premium rate increase of 10%. Other insurance coverages have been renewed at coverages similar to last year. Lastly, Bill Wojin, CFO, provided an update on the investment portfolios. As of May 1st, 2020, the retirement plan portfolio has lost 9% in value due to the COVID-19 pandemic. However, the retirement plan still has a very strong funded percentage of approximately 90%. The board designated funds have positive returns in 2020 through April 30th. Enhanced cash is up 0.81 net of fees, and the intermediate fund is up 3.48% net of fees. And that concludes my report.
Thank you, Joe. Next is our President's report. David Berenger, our President and CEO.
Thank you, Mr. Chairman. I'm going to start on my presentation. I think Bill's going to drive it for me on the screen. So as we start every month, we look at our organizational report card, and we look at the 5 different sections of that. First being service. Our goal in the service category is our likelihood of recommending the number of service areas at or greater than the 75th percentile to be 8 or higher. I'm happy to report to the board that we are maintaining this goal at all 10 out of 10 of the metrics. And I'll show you some detail on that here in a minute. In the people section, our organizational goal is to have a turnover of our part-time and full-time employees that have been hired within the last 12 months to be 24% turnover or less. I'm happy to report we're also beating that goal at 22.96%. In the quality section, our goal is to have our infection prevention, our overall combined standardization infection rate being 0.93 or less. We do remember that the national average or the expected is a 1.0, so we're always shooting for quite a bit better than that. And happy to report that we maintained our 0.72, so doing very well on infection rates. In finance, we have a goal of having our organizational finance, our operating margin, be at our budget of 6.5%. You saw Bill report on that earlier. That we are tracking at 6.9% for the year, although we clearly have a lot of variables and assumptions built into that due to the COVID situation. In the growth section, we have 2 goals. The first being our inpatient admissions and observation outpatients, being 46,070 for the year or higher. We are tracking that to be higher than that at 48,821. Once again, with some unknown about COVID going into the future. And our outpatient registrations having a goal at 894,000. We are now tracking less than that because of the decrease in visits from COVID at 840,000. So switch the page. We look at our patient experience report card. On the left-hand side, you see the 10 different sections that we look at for likelihood of recommending. Excuse me. The first green column that says national median score gives the national median scores for what are out nationally, and then the 75th percentile scores to the far right column. Our scores are in the middle in white, and what you are seeing is that we're beating the 75th or meeting it in every one of our areas. So we're 10 out of 10. Pretty remarkable considering what's going on in the industry right now, and really a tribute to our staff for what they do each and every day.
Remarkable.
Really, very, very good.
Thank you. I'll pass on your best wishes to them.
Please do. Oh boy.
On page 4, I want to talk about elective surgeries resumed on May 4th. Sarasota Memorial resumed elective and non-emergent procedures on Monday, May 4th, following an announcement by Governor Ron DeSantis that restrictions would be lifted. All Sarasota Memorial's operating rooms, robotic surgery suites, cardiac catheterization, and EP labs, endoscopy, bronch procedure suites, and our Cape Outpatient Surgery Center have now resumed operations with many measures in place to ensure safe care. So we are open for business in that area. Next page, we started running some ads, making sure the public would understand how safe of a place it is and what all we're doing to ensure both our patients and our staff's safety. So we're running ads in our local newspapers to inform the community of strict infection prevention protocols to protect the health and safety of our patients, including screening, temperature checks upon entry. So anyone who comes here as an employee or a patient is going to have a temperature check before they walk in and get a little sticker on their badge to ensure that they have that. Masks are provided to everyone and required to be worn within common areas and patient areas of the hospital. Continual cleaning with extra layer of sanitation provided by our Trudy robots. Visitation restrictions, so we are limiting or restricting visitation visitors in all sections of the hospital with some very few exceptions, and expanded pre-op testing for COVID. Going to page 5, the physicians group provides screening, seeing patients via telehealth or in person. Just to let you know that First Physicians Group is seeing patients both on a telehealth or in person, depending on the physician and the patient's needs. Page 7, Sarasota Memorial processing COVID tests for inpatients. Last month, Sarasota Memorial Hospital's lab services received a much awaited shipment of testing supplies to begin processing COVID tests for admitted hospital patients. The in-house testing allows the hospital to attain results in less than 2 hours, 24 hours a day, rather than wait for results from an outside lab, which have taken anywhere from 24 hours to 10 days. Testing of community members is offered by the Department of Health. So we are we do have a limited number of these tests that we're able to perform, so we are holding that just for our inpatient population and surgical prep. Technology making it easier for patients and families to stay connected. With the recent restrictions on visitors at the hospital, SMHs continue to look for ways to make it easier for patients and their families to communicate, especially when they're unable to use their own devices. Using dedicated iPads installed with FaceTime and Google Duo apps, our staff is able to arrange for virtual visits. Page 9, Sarasota Memorial continues to earn A grades for safety. Hospital safety report cards were released last month, and Sarasota Memorial has continued its straight A streak for keeping patients safe from medical errors, infections, accidents, and other harm to patients in our care. The Leapfrog Group assigns hospitals across the nation an A through an F safety grade in the spring and the fall of each year, based on the hospital performance on 28 publicly reported quality and safety data. Sarasota Memorial has earned straight A's since it began participating in Leapfrog's voluntary hospital survey in 2016. We had a little different this year, celebrating our nurses during National Nurses Week, and so we're going to keep celebrating them all year. National Nurses Week, which is held annually from May 6th to the 12th, is an opportunity to highlight the remarkable contributions of our nurses who have gone above and beyond this year in the fight against COVID-19. This year, we're not able to hold in-person celebrations for Nurses Week or other events, including Doctors Day, Volunteers Week, and many other staff recognition activities. But we hope to get everyone together and celebrate soon, as soon as it is safe to do that. We did do some videos and try to do as much as we could for our nurses on social media, and I think they did appreciate the effort.
We had a flyover too from McGill.
We had a flyover. Thank you, Sharon. We had a flyover from Dill just Friday, right? Friday to honor everyone that's working at the hospital. So very much appreciated them doing that. Thanks really to all of our staff for going above and beyond. We are practicing social distancing, sanitizing surfaces to protect our co-workers, managing our PPE and supply chain, keeping equipment clean and sterile processing, monitoring temperatures and masking for all staff, incoming staff and patients, keeping our nursing home and rehab residents happy and safe, and of course, working from home when we have the opportunity. Page 12, construction process at SMH Venice. Top left is the installation of our second floor electrical conduit. The top right, installation of caps on curtain wall, and bottom left, view of our bed tower. And we're on track to open in the fall of 2021. Construction progress in our radiation oncology center. Our temporary certificate of occupancy was issued by Sarasota County on Friday, May 1st. A business use license will be issued next. One linear accelerator has been commissioned. The second linear accelerator commissioning is on the way. CT simulator arrived May 13th, and pre-installation inspection has been completed. And grand opening is slated for July 15th, and the first patient being scheduled is August 3rd. So we're very excited about this, and certainly invite you to drive by this facility to take a look. Construction progress on our oncology tower. Levels 5 and 6 framework and debt work are in progress. Underground utility work will be completed this month. The contractor has implemented rules around hand washing, wearing face masks and gloves, and distancing while working on site. And all employees are monitored daily on the work site. The tower is scheduled to open also in the fall of 2021. And that is my report. I'm happy to answer any questions anyone has.
Question? Thank you, David. Very helpful.
Thank you.
Are there any public comment requests?
No, sir, there are not.
Thank you. Hearing none, we'll turn to our Chief Legal Officer for legal matters.
I have no report.
Do we have any other business to discuss? Hearing none, I ask for a motion to adjourn. Second, we are adjourned. Thank you.
Thank you.
Out here.
All right, everyone. Thanks so much for participating. Be safe.
Has left the meeting.